Good morning. My name is Kopano Mabaso and I'm an emerging voice from South Africa. And today I'll be telling you a little bit about research that I did on single purchaser versus multiple purchaser health financing systems and their comparative advantages and disadvantages in achieving the goals of universal health coverage to help inform South Africa's healthcare reforms. So, just that we can get our definitions out of the way right at the beginning of this presentation, when we refer to a single purchaser of health services, we refer to one purchaser of services for a single community in a single geographical area, as opposed to multiple purchases of services for many communities, often purchasing these services in competition in a single geographical area. South Africa is currently in the process of making substantial changes to the financing of its healthcare system. In August 2011, the South African government released a draft policy paper that revealed plans to introduce a national health insurance system, also referred to as the NHI. And this NHI is described as a mandatory prepayment system that promises to provide all South Africans with universal health coverage. Universal health coverage, as you all know, is a concept that is at the forefront of all health systems discourse the world over, and no less so in South Africa. And it is universal health coverage that is the backdrop against which the South African health financing reforms are framed. Our review focused on the cornerstones of universal health coverage, which are access to needed care for all and financial risk protection for all. Achieving universal health coverage is of immense importance in South Africa, which has a highly inequitable healthcare system, comprised of a failing public sector and a private sector that accounts for the greater proportion of health expenditure, but serves only a fraction of the population. As you can see from the following headlines, the South African government's plans to introduce an NHI were met with as much praise as criticism. One of the key, and at the time of this review, as yet unanswered questions was whether the health system should be organized as a single purchaser or as a multiple purchaser system. Now, this is a sticky question in South Africa because our health system is deeply entrenched into two tiers. One tier being a tax-funded, crumbling public sector that is buckling under the weight of having to serve over 80% of the country's population. And the other, a fragmented private sector made up of over 100 medical schemes, which are not only inequitable but becoming increasingly unaffordable. It is argued by some that instead of relegating these medical schemes to dealing solely with the top-up healthcare preferences of the very rich, they instead should be included in the South African health financing reforms as the financing intermediaries of the NHI. In other words, as the multiple purchasers. So the aim of our research was simple: to generate evidence to help inform decision making in South Africa's health financing policy process. The methodology we used was that of the scoping review. This was selected as the methodology of choice because it places greater emphasis on relevance of study rather than quality of study. Now, as you know, this is of particular importance in synthesizing health systems research because relying on the rigid criteria of Cochrane type reviews don't always lend themselves to answering the types of questions that policymakers interested in strengthening the health system are interested in, and also the reviews are often left empty. The other reason why the scoping review was the methodology of choice, because it allows for a consultative process which helps to inform, validate, and give context to the findings in the literature. Our review looked at 6 countries, and the criteria of inclusion were countries that had well-established mandatory prepayment systems whose goal is to achieve universal health coverage. And of the single purchaser systems, we included England, South Korea, and Canada. And of the multiple purchaser systems, we included Germany, the Netherlands, and Thailand. We first compared the countries analyzed according to the extent of the population covered, the extent of services covered, and the extent of costs covered. Our single purchaser systems were able to cover 100% of the population, whereas the multiple purchaser systems were better able to offer their community a wider range of services. When it came to the extent of costs covered, the differences between single purchaser and multiple purchaser were less clear. We also looked at how well these health systems protected their households from catastrophic health expenditure, and our single purchaser systems appear to be better at protecting households from financial risk as a result of health expenditure. In terms of equity of financing, our single purchaser systems tended to have more progressive financing of their health systems, which is shown by the Kopano indices that are mostly positive. Access to care, equitable access to care, especially specialist care, was a challenge for many of our health systems, regardless of whether they were single purchaser or multiple purchaser. But when this was unpacked further and discussed further with our experts, it did appear that single purchaser systems, in the very least, were easier to navigate. An interesting finding was that, contrary to conventional wisdom, it was the multiple purchaser systems that were better able to implement provider payment mechanisms that incentivized for efficiency. And with regards to cost containments, our single purchaser systems were better able to contain costs, especially administrative costs. So in summary, the single purchaser systems win. Of course, this does not mean that multiple purchaser systems are unable to achieve the goals of universal health coverage, but they do so with greater administrative costs and requiring tighter regulatory mechanisms. An interesting finding, however, was that when we looked at the histories and the context within which the decision to go the single purchaser or multiple purchaser route was made in the countries that were analyzed, one consistent finding was that it had less to do with the evidence and more to do with the politics of the time. Now, what this tells us as researchers is that we can't, one, ignore the politics of healthcare reform in our countries, and secondly, we can't just hope for the best, but that we need to manipulate the political conditions towards empirical evidence and look out for and make use of political windows of opportunity. Thank you for your time.